Did you know that almost 50% of women, which is half of the women in the reproductive age group, they suffer from something called as heavy menstrual bleeding, which is an abnormal form of bleeding during the time of a menstrual cycle. It is a very, very common problem, but is often ignored because of the lack of awareness among women as to what is normal, what is abnormal, as well as there's a lot of social and cultural taboos where women don't feel comfortable talking about the menstrual cycle among themselves or even to their physicians. Let's see why it should not be ignored. We know that heavy menstrual bleeding can be very disruptive to your normal life. Nobody likes going to the bathroom every 2 hours, changing the pads every 2 hours, soaking through the pads in public, or soaking through your clothes. It's very, very disruptive to your life. Not only that, it can also cause iron deficiency anemia, and we know that this can affect women's health in many ways. It can cause shortness of breath, weakness, extreme fatigue, hair loss, and in extreme cases it can also cause heart failure, and it can also affect the pregnancy outcomes. If women is having iron deficiency anemia, they can also affect pregnancy outcomes. So let's not ignore the heavy menstrual bleeding, and if you think you're suffering from heavy menstrual bleeding, please seek professional advice. In the next series, we'll talk about what are the causes of heavy menstrual bleeding and what can be done medically, as well as what all dietary interventions we can do to help build up our hemoglobin so that we don't get iron deficiency.